When should you see an oculoplastic surgeon for facial trauma? If you've experienced any injury to your face, it's crucial to seek medical attention promptly. Facial trauma can range from minor cuts and bruises to more severe injuries like fractures or deep lacerations. An oculoplastic surgeon specializes in the delicate structures around the eyes, including the eyelids, tear ducts, and the bones of the eye socket. If your injury involves these areas, an oculoplastic surgeon is the right specialist to consult. You should consider seeing an oculoplastic surgeon if you have persistent pain or swelling around the eyes, changes in vision, difficulty moving your eyes, noticeable deformities or asymmetry in the facial structure, or any injury that affects the eyelids or tear ducts. Early intervention by a specialist can prevent complications and ensure the best possible outcome for your recovery. Don't wait until symptoms worsen. If in doubt, consult an oculoplastic surgeon to get a professional assessment and appropriate treatment. Remember, your eyes and the surrounding structures are vital for your overall well-being. Taking prompt action can make a significant difference in your recovery and long-term health.